Since usually what I have to say about AFINet in the beginning always remains the same, I think I would like, first of all, to welcome all of you to another AFINet webinar. And most of you will know that the Addiction and the Family International Network has come together quite a long time ago in order to promote the well-being of family members by bringing together researchers, policymakers, practitioners, and experts through experience. Membership is free. You can apply on the website if you are not a member yet. And the series of webinars started in October 2020. So at the moment, it's almost 2 years that we started with the webinars. And since we are a small charity, the participation at the webinar is free, but we would welcome donations if you think you're able to do so. And it's a great pleasure today to have to introduce Ira Kusumawaty from Indonesia, from the Mental Health Department of the Polytechnic Kesehatan Palembang, Indonesia. I'm not sure whether I pronounced this right. She has been involved in teaching, conducting research and community empowerment, as well as assessing policy studies in the field of mental health in the last 15 years. And she has quite a number of publications on various subjects, including family-related topics, but not restricted to this. So she's also done quite a lot of research on COVID-19 and related issues. And if you want to have a closer look at her work, you can also visit her page at ResearchGate. And today, she will present on family resilience in caring for drug addiction. And after her talk, there will be space for questions, as you all know. And it's a great pleasure to have you, and good evening to Sumatra. And I would like to hand over to Ira. The floor is yours.
Thank you for the opportunity to provide to us. Thank you to AFINet, Dr. Gallus, Professor Richard, and the experts in AFINet. I will try to share my slides first. Okay. Can you see my slide?
That's perfect.
Yes. Thank you. Ladies and gentlemen, today I would like to present our result study, which is entitled Family Resilience in Caring for Drug Addiction. Our team, Ira, and then Yunike, Jawiyah, and Rehana. We are from Polytechnic Kesehatan Palembang, which is located at Palembang as the capital city of South Sumatra province. For the first presentation, I would like to present the outline. Initially, start with background, and then continue with the objective of this research, next to the method of this research, and continue with the data collection, data analysis, and furthermore, the result, and lastly, with the
no camera is not
on. And lastly, the references. We move on to the next slides. This slide shows you the map of Indonesia.
Yes.
Then at the red highlight, there is the location of...
Ira, can I just pause you for a second? Could people please turn their microphones off? Because we're hearing quite a lot of talking.
Okay.
Thank you very much.
Yeah.
This is YouTube.
So please carry on, Ira. I didn't mean you to turn your microphone off.
Yeah, I did it. Okay. Am I audible?
Yes, you're very audible. Please carry on.
Yeah, thank you. This is the map of Indonesia. And then at the red highlight, I show you the location of Palembang as the south part of Sumatra Island. This is the South Sumatra province. Okay, for the background of this study, why I choose Palembang as the location of our study, because Palembang is the capital city of South Sumatra province in Indonesia. And it is also one of the oldest cities in Indonesia. Palembang also has a history of being a capital of maritime empire millennia ago. In terms of population, it has 1.7 million for area of 461 square kilometers. Palembang is also the second largest city in Sumatra after Medan, but it is also becoming the seventh largest city in Indonesia. How is the data which is related with the drug addiction? There is an increasing in number in South Sumatra province, actually in Palembang, in terms about drug addiction. In 2019, the cases number is 2,000, and in 2021, increasing, becoming 2,763 cases. According to this number, the government announced that South Sumatra facing an emergency for drug users and dealers. We can continue with other background of this study, that substance abuse and addiction issues are related to well-being, economic difficulties, stereotypes, even isolation, and then mentally ill. And the worst thing is suicide rise. This is the worst thing that as the effect of substance abuse. And because of that, the role of family becoming as the center of problem solving, because the family with children, with our family member with a substance abuse of drug addiction, they have to facing a complex problem, fluctuation problem, and so need support from the family. What is family resilience? Family resilience. Family resilience in facing addiction problems depends on all family members, which is strongly influenced by tasks, habits, activities, finances, relationship, disputes, and community interaction. And then we have already known that addiction is one of the problems that cause conflicts in the family, which has negative consequences. What is resilience itself? So many definitions about resilience, but actually resilience is a concept that was initially developed in developmental psychopathology and is based on ecology, stress, and coping. And resilience is the ability to withstand adversity and to bounce back from difficult life events. It's, of course, the hard things to do this action, yeah, the ability. And another reference said that the resilience is the capability of a strained body to recover its size and shape after deformation caused especially by compressive stress. And the capacity to deal successfully, it can be happen while the obstacles on the road that confront us while maintaining a straight and true path towards life's goal. We move on to how is one resilience ability. This is the important thing that we have to know. The type of resilience ability that we have to know. Resilience, of course, isn't a fixed trait and it is not constant. It's fluctuated, depend on our capability, depend on the stress that we have to face and the challenge that we have to face. So it isn't a passive, yeah, it is dynamic. And being resilient does not mean a person doesn't experience stress or emotional upheaval and suffering. So we can to be a resilient people. So through the experience of stress or emotional upheaval. And another study said resilience involves the ability to work through emotional pain and suffering. Flexibility, adaptability, and perseverance can help people tap into their resilience by changing certain thought and behavior. So from this definition, we can see that thought and behavior have very influence impact on the form of flexibility, adaptability, and perseverance. Now we move to the reason why resilience is important, why we have to study, the team have to study the family resilience. There are so many reasons of the importance of resilience because people face all kinds of adversity in life, personal crises such as illnesses, loss of a loved one, such as in case of addicted children, our children will addicted or abused. This is the kind of loss of a loved one. Abuse, bullying, job loss, and financial instability. And why resilience is important? Because the shared reality of a tragic event in the news, such as terrorist attacks, mass shootings, natural disasters, a global pandemic, and war. And as the people, we have to learn to cope when we have to facing this stress, this we have to facing the adversity of life in our life, cope with and work through very challenging life experiences. Actually, resilience involves 5 principles. You have to know about this. So we can implement this principle to our life. The first one is gratitude. What is gratitude? Gratitude is a positive emotion that involves being thankful and appreciative and is associated with several mental and physical health benefits. This is the first principle, gratitude. The second one is compassion. Compassion is an emotion that causes you to feel what someone else feels and want to relieve their pain. Yeah. The third one is an acceptance. Acceptance can be the meaning of a person assent to the reality of a situation, recognizing a process or condition. meaning. We have to denoting that which is intended or actually is expressed or indicated. So we have to be smart to know the meaning of every fact, of every stressful situation for someone. Forgiveness. Forgiveness, it involves a decision to let go of resentment and thoughts of revenge. So the point is to let go of everything that make our heart. Yeah. Some research already say the book about the importance of resilience. So many previous research about the importance of resilience and the correlation with mentally or physically ill. For example, the correlation between mental health and resilience, that resilience is a protective factor against psychological distress in adverse situation involving loss or trauma, and help in the management of stress level and depressive symptoms. And also psychological resilience refer to mental fortitude to handle challenges and adversity. This is the hard thing to tackle psychological distress. Emotional resilience. Emotional resilience was linked to reduced stress and a more positive life satisfaction. Overall, for example, during the early stages of the COVID-19 pandemic. And interestingly that people who had attempted suicide had significantly lower resilience scale scores than people who had never attempted suicide. Very significant impact of resilience to mental health. In terms of physical health, for the example, the previous study show the connected between rheumatoid arthritis and resilience. It said that behavioral and emotional strategies to cultivate resilience can benefit patients with rheumatoid arthritis and other chronic diseases. And optimism and perceived social support have the next example, the study illustrate the correlation between immunological disorder and resilience. They said that physical resilience can reduce the adverse effect that stressor have on the immune system. Low resilience is associated with worsening of disease, whereas high resilience is associated with better quality of life. There's examples in terms of brain injuries. The research explained that previous research explained that patients with traumatic brain injuries who tested moderate high on a resilience scale reported significantly fewer post-injury symptoms, and they can get better quality of life than those patients who with low resilience. Yeah, and then we continue with other conditions, skin condition, and resilience. For example, psoriasis patient, they show signs of less resilience, and early intervention to build resilience in psoriasis itself. For the next example, the cases in endometriosis patient. Endometriosis potentially debilitating pain to depressive mood, anxiety, and of course reduce resilience. Okay, Now I will show or explain the scope of resilience, which is related with this study, that the process and the outcome of successfully adapting to difficult or challenging life experience. That is the first scope of resilience, how we can successfully adapting to stressor, to challenging life experience. The second one, that it has been studied across different fields, not only psychiatry, human development, and management, but also psychology and other different fields has already involved in resilience, being studied in resilience. And the scope of resilience is having the mental, emotional, and behavioral flexibility and ability to adjust not only to internal demand, but also external demand. So the two demands will be adjusted through the mental, emotional, and behavioral flexibility and ability to become a resilient people. We continue with the next slide about some types of resilience. The first type is psychological resilience. Second one, emotional resilience. The third one, physical resilience. And the last is community resilience. In psychological resilience, this must be some aspect related to some aspect of psychology. And then the emotional is related with the emotion, people emotional, and the physical resilience related with how is the physical condition influenced by the level of resilience. And then the community resilience, it is becoming the collection of family resilience. There are some key factors that can be contribute to one's personal resilience. There are four key factors. The first one, the way someone views and engage with the world. It is very influenced how people becoming more resilient or less resilient. The second one, the availability and quality of social resources in terms of social support, in terms of social system. These social resources, of course, contribute to resilience people forming. The third one is specific coping strategies. How is the capability of someone when they have to implement the specific coping? Which strategies is adequate for one stressor, which coping strategies will adequate for others. The fourth one is a combination of factors contribute to building resilience. This is the combination between the way someone views and then the availability and quality of social resources and specific coping strategies. I will show you from the reference and also from the previous study some resilience building factors, social support, self-esteem, and then coping skills, communication skills, and emotional skills, which will explain in the next slide. If we talk about social support, it means one supportive social system, which can include immediate or extended family, community, friends, or organization, which can foster one's resilience in times of crisis or trauma, and support resilience in the individual. In terms of self-esteem, Self-esteem and resilience is really close related each other. Coping skill, positive coping skill like optimism and sharing can help bolster resilience more than non-productive coping skills, of course. And the other building factors is communication skill. The people who are able to interact with each other and can to be the empathy person and can give can inspire to build confidence, to building trusting relationship. It should be they becoming to be more resilient than other. And the last building factors is emotional regulation. The capacity to manage potentially overwhelming emotion when overcoming a challenge and has been linked to improve resilience. Ladies and gentlemen, now we move to the characteristic of a resilient person. A resilient person, they have social support. Social support can be family, friends, colleagues. So when we have the problem, we can call them, we can contact them, and we can express our feeling to get the solution of our problem. The second one, the resilient person, they have problem-solving skills. They can identify that problem. They can determine which kind of problem solving they have to conduct it, to implement, to solve their problem. The third one is optimism. Resilient people, they have to get high optimism. When the going gets tough, they believe in their ability to handle it. So they usually in positive thinking. They're always optimistic to handle everything. The coping skill. The resilient people, the resilient person, they have techniques to reduce stress and to reduce anxiety by using coping skills. Self-awareness. They know their strength, they know their limitation, but they also know the weakness, the positive, the negative aspect of themselves. It is important because by enhancing our self-awareness, we can put into internal resources to work. We can by identifying, by knowing the strength and then our weakness, we can improve our strength and we can lowering our weakness. So as the last background of this study, that we can emphasize that the basic insight looks at family stability by highlighting the cohesive complexities of the family as a whole and the mother as a central position. Community resilience is a social goal accompanied by flexibility achievement in facing difficulties, both current and potential problems. And resilience of families will react positively to this situation in a characteristic sense. And the resilience, the problems faced by the family can be viewed in struggle and challenge. In an individual, the other main protection and healing elements can hardly take any crucial component. We move on the objective of this study. What is the objective of this study? This study wants to explore the experience of family resilience based on the perspective of parents when their children are addicted to drugs. And then it means that we want to do the exploration, investigation according to family resiliences experience when they have to tackle off their children who are addicted to drugs. The method that we use in this study, I will show you that the research location in Palembang, South Sumatra province, and the types of sources data. This research is a qualitative research. We conducted the qualitative study and we implemented a phenomenological approach, and data was obtained from 8 participants through in-depth interview. So this study was used the primary data. How to determine the number of the study or the who will be involved in the study. We implemented the purposive sampling technique, which is that we have some inclusion criteria. Our inclusion criteria are mothers who have experience caring for their children with drug addicts, but they also educated at a school with drug addiction recovery programs. And in Palembang, there is only one school in only one school which has recovery programs, and the activities is emphasizes on behavior change and religious spiritual approach counseling. And then the activities like recite or pray and zikir. Another inclusion criteria of this sample is willing to be involved in the study. We move on to the data collection technique slide. This study use in-depth interview and then observation for triangulation of this data, and also field notes. We use a voice recorder during the in-depth interview to record the interviewing process. We collected the data from 8 participants. Why we collected 8 participants? Because after we interview them, we get the same meaning of each information that they give to us. So we think that we obtain the saturation after we did the in-depth interview to 8 participants. But before we did the data collection, we explained the information to give the explanation for the participant and make sure that the study will not give any harm for them. And after they understand the informed consent, they sign the informed consent in front of the researcher. Before we conducted the study, we proposed our proposal to Palembang Health Polytechnic Ethics Committee to obtain the ethical clearance. After we get the ethical clearance, so we continue with the data collection. This study was conducted for 6 months, start in July and until December 2019. And I will show you, because the primary data is obtained by doing in-depth interview. So I will show you the interviewing guide here. There are 5 questions for the participant. The first question is, how did you feel when you find out that your child was addicted to drugs? The second question, what is the mother's experience when caring for a child who is addicted to drugs? Thirdly, what is the pattern of communication so far between family members? And fourth, how to fulfill your economic needs as a supporter of family life? And lastly, how is the support provided by the environment for mothers when it comes to caring for children who are addicted to drugs? Before we use this interviewing guide, we try to make a test to a layperson to know is it the question can be understood by them. After we collected the data, we implemented the data analysis. The result of the data collection is writing down on transcript and to exploring, because our study has the objective to exploring mother experience when caring for drug addicts. So in this study, we analyze by using interpretive phenomenological analysis. There are seven phases of analysis. Start with reading the transcript repeatedly and continue with making preliminary notes. Continue with developing emerging themes, looking for general relationship between the themes, and then we continuing to the next case and looking for the same pattern between cases. And lastly, we describe the main theme. Along with the phase analysis phase, we do the member checking with the patient. It means that we want to make understanding at the same level with participant understanding. Besides member checking, we also did peer debriefing. It means work together in terms of how to write down the transcript, method, and finding to get the validity or to enhance our validity. It's very important because we want to get the research credibility and trustworthiness in qualitative study. What is the result of this study? According to the data collection, the result of this study that we involved 8 mothers aged 36 to 50 years old, and they had a low educational background. They also in a lower middle socioeconomic level, and they had 3 to 5 children. And according to analysis of the research result, there are 5 themes can be formulated, which can group into 2 main themes. There are 2 groups. There are 2 main themes. The first main themes is values that support the formation of family resilience. And then the second main themes is values that hinder family resilience. Only one themes that support the main themes. It is God's destiny, and there are four themes that support the second main themes. The first one is limited financial condition, the erosion of togetherness value, fragile family flexibility, and the last one, the harshness of the environment. We move on to the result. This is, I show you the table which illustrate the interview quotes and the themes of according to in-depth interview with our participants. We move to discussion slide. On the discussion, we try to make a comparison between our study and then previous study and other references. Yeah, that family resilience may also be related to attempts to reinforce individuals and communities when perceived structurally. And the second one, under discussion, we also describe in the sense of resilience that family-related aspects are often attributed to family or injury, but also to certain variables along with comfort, love, and social desire. And in this section of discussion, we also try to illustrate that family resilience will strengthen individual resilience in responding to environmental influence and to a large extent correlates with community resilience. Actually, of course, in this study in children with drug addiction. Now I will show you the slide which illustrate per team, first team, second team, third team, until fifth team. For the first team, it's God's destiny. That the stressor for the participants, stressor face as the cause of stress and crisis. And when experiencing problems, effort to strengthen themselves are made by family by focusing on God Almighty. Religious activities carry out arouse optimism, of course. And then the result of the meta-analysis of the previous study show that 95% of families strengthen themselves through the implementation of spiritual activities. Is very significant, 95%. But in terms of spirituality, it's not only related to religion. It remains a belief to present God at every stage of life. And the value of spirituality strengthens the relationship between family, community, and the universe. Still in its God's destiny, there is, according to previous study, there is a correlation between children's prayer habits, social behavior, and healthcare behavior. In this study, because the children is also educated from the school, which activate them with spiritual activity. So it makes family to enhance their resilience. In the case study, the majority of families in this study, the family were devote their families in worship. Her submission to accept her child's current condition is a form of her spiritual belief in God Almighty. Carrying out her worship and giving up her current condition because she considered the event that occurred were the will of the Almighty. Participants are very aware about the problems. Before their children are a condition that cannot be reversed. There is a fact. So the children condition make them be more aware. Everything that happened to her was considered God's destiny. As a mother, the participant felt very guilty and had to accept the fate imposed on their families. And then we move to the second team. The second theme is a limited financial condition. At the second theme, the fact on our study that is the situation that lack of family harmony and resilience can be triggered by poor financial and or economic condition, which ultimately have a negative impact on parenting, poor decision making, and neglected family welfare. And even now, it is not possible to estimate the economic aspect due to the use of illegal drugs, even though the negative impacts are very clear in the families of the participants. The majority were families who were in the middle and lower social status. Yeah, and the participant also live in a rental house. So the arrangement for distributing family income in addition to meeting basic needs must also take into account to need to pay the rent. This is the difficult situation. This condition causes children get less attention, of course, because the family focus is more on meeting economic needs. We move to the third theme, the erosion of togetherness value. In this discussion section, we illustrate that many references suggest the magnitude of the benefit of the family in utilizing time together in supporting health in the family, and the lack of time being together or togetherness in the family has a significant impact on the divorce rate. In addition, that engagement, happiness, sharing experiences, and appreciation will result from being together with family through interactive communication. And economic stress, of course, will affect the emotional life and marital interaction of adults. And then it can be spread to the nurturing environment of adolescent. Lastly, the finding solution to problems and negotiating skills can be developed in family togetherness. There are four discussion also in the erosion of togetherness value. Participants realized that the lack of time together with their adolescent because they were busier and more focused on fulfilling daily needs. So there is a similarity perception, yeah, between participant and the previous study. Poor families experience the complexity of life pressures and are more likely to experience the risk of problems. And they realize that without feeling the attention to the child is getting faded, adolescents feel a lack of attention. So they have no place to express their feelings. So the children are prone to express their feelings to their social life, to their community, to the public, to their friends. Yeah. And the last explanation regarding this theme, that ambiguous communication leads to misunderstanding, distrust, and discomfort. May I drink first? So sorry. Thank you. Am I audible?
Yeah, we can hear you.
Thank you. We move to the fourth theme. It is fragile family flexibility. According to this study, most participants felt obstacles in expressing their opinions. The openness in conveying feelings in the form of words, attitudes, and behavior fosters trust, of course. that building trusting a relationship between parents and children is very crucial. And then the next, families can perform their function well, will be able to bring out ideas and creativity for all family members. The importance of process of collaboration and negotiation will form the basis of problem-solving efforts in family resilience. So sitting together, sharing our experience, negotiate each other, collaborate is very important in family. So the problem-solving efforts will implemented the adequate coping strategies. A strong family will try to listen, understand, and respect the feelings of each family member and avoid blaming, of course. And a rigid communication pattern will ensnare families in the phenomenon of independence, which threatens the family system. The family will become unable to cope with stress, and it will impact that the child will try to search another life outside of their family. Still continue with the same thing, the discussion section. The participants in this study feel unable to carry out their roles properly, and children become more dominant in their family, and there is no tolerance. But the family faces repeated disappointment because they feel they are failed to take care of their children. The harshness of the environment can affect the cohesiveness of ties in family resilience, and the reciprocal relationship between the family and the environment will illustrate the formation of a family resilience. And the family resilience also has a good impact in terms of academic value of our children. The increasing academic value if the environment is comfort. This is support the result of this study. For poor families, the environment will provide limited hope, like in this study. Both desires and expectation render environmental support and assistance. We move on to conclusion slide, the last part, almost the last part of this slide, that addiction in adolescence occurs when family resilience cannot be achieved. The second one, mothers play an extremely crucial role in preventing addiction in adolescents. An integrated multi-sector approach is incredibly needed, and the families can survive optimally as the core of community resilience. And the last one, the internal and external factors are closely involved in maintaining and increasing family resilience. This is the conclusion of our study, and this is the references. And this study, of course, do not perfect. There is a limitation of this study because this study only conducted in one capital, in one capital city or in one city. So the result cannot be generalized to other population. This is the references. Okay, thank you for your attention, and I'll give the time to moderator. Thank you. Can I stop sharing now?
You should be able to, yeah. So
Yep.
first of all, thank you very much for your presentation.
Yeah.
And maybe if you could turn on your camera, this would be nice. At least I can't see you at the moment.
Yeah.
And now there is some room for questions. I haven't seen any yet in the chat. So I would take the privilege to start with 2 questions in the beginning before Richard will jump in. Question number 1, I was wondering if you could say a few more words about what kind of drugs these children were addicted to. And the second question is, I was wondering, you focused on the mothers, what about the fathers? If you could say a few words about that.
Yeah. Dr. Galus, could you please explain more, because at the moment I try to stop sharing and I lost the question.
I'll just repeat. I was just wondering what kind of addictions to illegal drugs these mothers were faced with. Was it heroin or cannabis or whatever? And the second question was, since you restricted your research to mothers, I was wondering, what about the fathers, about the role of the fathers in these families?
Okay. Thank you, Dr. Galus, for the question. In Palembang, the most, teenager here, they use heroin, yeah, heroin. Most of them use heroin, and then the glue. Did you hear about the glue? A certain glue, because it's cheap, very cheap, and then usually for the poor people, for poor teenager, they use that glue.
Okay.
And then the second one, in terms of the fathers, yeah. Why I only involve the mother? Because the mothers in here is the mothers who always caring of the children, and the father only limited time for the children, because they are busy to fulfill the economic family. They are very poor. You can imagine that if in a day they only get it around 20,000 rupiahs, or almost $2 America per day, to fulfill their need in their family. So it can imagine it's very poor condition. So I only involve the mother, because they have 100% time only at home to take care of their child. There is Dr. Galus.
Yeah, perfect. So it's rather traditional family structures, and mothers are the ones who are responsible for the education of the children. Thank you. I also see Doreen has raised her hand, so
yes.
I'll hand over to Doreen.
Hi, here I am. Thanks a lot, Ira. How should I pronounce it?
Hi, Doreen.
Thanks very much for your interesting presentation. I want to ask you the following. You said that the mothers were able to accept the addiction of their children because they see it as God's will. And at the same time, you said the mothers felt guilty or very guilty. How do these two relate?
Yeah. So this is the process of feeling guilty as the you have to question. The first one, how is the connection? The connection between that the first theme or the participant said that mother accept there is the God will, but on the other side, there is something like they denied their children, that there is they denied, and then also they try to accept their children condition. In this, in my perspective, there is a process. At the first, according to the theory of Kubler-Ross, when somebody get the stressor, usually at the first step is they deny to the condition, to the bad fact. There is a denial condition. Then after they after a moment, after denial, they can the reaction after denial is anger. The anger to the condition. I hate this. Why my children to be addicted to drugs? But after that moment, over the process, there is a bargaining process. The bargain. How God give our family the child like this condition, and after that, depression. There is depression before acceptance. The family becoming in depression, in the depression stage. Yeah, this is our child. Yeah, this is our child because of our guilty. They are the mothers in a depression stage. But after that, after a few moments, they can accept there is the God destiny. There is the God's will. That's my answer. I hopefully can answer, but maybe you have feedback or maybe opinion about that. Please. Okay. You can share with me.
Thank you. Thank you.
Thank you. You're welcome.
Okay, so now I'll hand over to Richard.
Okay, thank you, Ira, very much indeed. And first, I think for a very interesting presentation and a very interesting insight into how drug problems and families are thought about in Indonesia. And it's very exciting for us. And there are many people from many different parts of the world here listening to this webinar. So it's very interesting to get such a very different perspective from another part of the world, which many of us are not going to be that familiar with. I have a number of questions, but I don't want to take up everybody's time, so I will ask them one at a time and see if other people come up with other questions. Let me just follow up what you were just answering to Doreen, though. I think it's firstly very interesting to use the Kubler-Ross understanding of bereavement and the stages that people go through when they're dealing with a bereavement to use that in thinking about what family members go through when they're dealing with somebody in the family who gets a drug problem. So I think that whole issue of to what extent is having someone in the family having a drug problem like a bereavement, and certainly a lot of research does say that for many family members, they do feel that there is something like a bereavement. They do feel that they've lost something. I remember people who I've interviewed saying to me, I don't know where my son has gone. This person is not the same person as the person I brought up. So this bereavement idea is a very interesting one. Did I understand you, though, when you were saying about the stages, that, as Doreen was saying, how can somebody both feel guilty and at the same time feel that it's God's will? And did I understand you to be saying that actually they weren't feeling that at the same time, that it was a process, and so they may be feeling guilty at one stage, but finally they get to acceptance, and that's a different stage? Did I understand that correctly?
Yeah. Yes, yes, Professor. Yes, I mean that it's a process. Process not happen at the same time. After right. They felt guilty, and after that the process is going on, and then they can accept their child condition. Thank you.
Okay, so that's I think really interesting, and I think there's also the idea of us who are listening, different people who are thinking about doing research into this area. I wonder if there is collected together already research which has looked at develop a drug problem developing in the family as a bereavement. I think that would be that's a very interesting area that we should be investigating a lot more. Let me also, and then I'll stop, but ask you another question about fathers. I understand why you interviewed mothers, but I'm interested in knowing what the mothers said about the fathers and what the mothers said about what they thought the role of the father was, either in terms of preventing the drug problem or in terms of helping the family come to terms with it and helping their child come out of the drug problem. What did mothers say about the father's role?
Thank you for the question, Professor. The mother said that the father role in terms of the family is in the context of economic, how to fulfill the family basic needs. How can buy the food, or how can they bring them to educate, to school, that's all. And then how to take care of the children, it's majority as the role of mother. That's what I get from this study, Professor.
Right. Okay. So they don't really see the fathers to have much of a role because they're so busy with providing economically.
Yeah.
Okay. Quite interesting, because I think this is also shows us well the large differences we have between cultural expressions of family. But Jim, you raised your hand, so up to you.
Yes, thank you. First of all, thank you very much for your talk. As Richard said, it's so interesting to us to hear, from a country that we don't hear so much about. So thank you very much. It really is. Two things really. Firstly, I would just like to follow up on this question of acceptance, which we're all so interested in. I think I realized from your answer previously that acceptance can mean several different things, can't it? One thing I'm particularly interested in is, does acceptance necessarily mean there's nothing I can do about this? I've got to accept that my child has this problem, and therefore there's not very much I can do about it. That's one thing. And then my other question was going to be about how likely you think it is that what you found in this sample is quite general for South Sumatra, shall we say, or even for Indonesia generally, because you finished by saying, quite correctly, I'm sure, that one shouldn't generalize from one sample, but I'd be very interested to know whether you think you're finding something quite general about the culture in which you're working, because this idea of accepting that something is God's destiny seems quite foreign to me, sitting in England here. So how general, so two questions then. Does acceptance mean there's nothing you can do about it? And secondly, how generalizable do you think your results are in your part of the world?
Yeah, nice question, Dr. James. I try to answer your question. I will answer first, which is your second question. The second question about how to generalize, how about my explanation at the last explanation in my slide, that can be a limitation of our study. We think that this study, because only did in one locally city in Palembang, and in certain culture, in certain pattern of how the patterns of the parents when they have to take care of their children, and the culture, the culture in the belief or in Palembang is different with other side of Indonesia. For example, in Java Island. In Java Island, there are very contradicted situation with South Sumatra. In South Sumatra, the character of the people is very contradicted with Javanese people. So this condition, in my perspective, will be influenced on how parents to take care of their children. So that is in our team opinions that this study has the limitation in terms of generalized to other part of Indonesia. That is my answer. And then for the first question, and could you please explain?
Yes, it was about yes, on acceptance.
Acceptance.
Does acceptance mean or imply, therefore, there is nothing I can do?
Yeah. Actually, that's the truth. The true situation, Dr. James. The mother can accept their children because there's nothing to do about their child. Yes, there is. I have to accept them as the God destiny. So I cannot refuse them. So they cannot do anything, of course. That is Dr. James. Thank you. You're welcome.
Okay, there are two more questions in the line. First of all, there's Jan, and then afterwards, Doreen once more.
Yes, thank you. And thank you for an interesting presentation. My question was about, there was a slide about education, and I wasn't sure whether it was education that the mothers had received as they were growing up about drug addiction, or education about recovery now in their role as a mother? So I was just kind of a question about how much education is there about drug addiction for family members or for children growing up?
Okay. Thank you for the question. Interesting question, Jen. There is a limitation. There is a limitation. How is the lay people, the community, get the information about the addiction, being addiction, the dangerous heroin, even the dangerous of the glue, the effect, the bad effect to the body. So be honest that maybe how to packaging the information is not suitable for them. So they cannot receive completely about the information. And actually, in terms of language, I mean the packaging of the information, I think the government should develop by lowering the language in packaging the information related to the addiction cases, Jen. Very interesting question, Jen, for that.
Thank you.
Thank you.
Very.
Yes, I have another question. You said that families strengthen themselves through spiritual activities. Can you say a little bit more about how these activities look like? Is that praying? Is that praying together as a family? Are there more than, or are there also other activities? And how do they look like?
Yeah, they have the regular activities in terms of pray together, and they recite Quran once a week, every in Thursday night, and on Thursday night, even only one surah. They always did this regularly in a family, so that they tell that it gives us the power, the power to make them more powerful, to make them more can accept the situation. They use the spirituality approach for that.
Okay, thank you.
Thank you. You're welcome.
Okay, Richard has raised his hand, but there's also a note in the chat from Dave and Tina asking if it is the mother's responsibility to check the child, how can she stop them using drugs? And I'm not entirely sure whether this question is directed at Ira. Probably you could elaborate briefly on that. Was a question to Dave and Tina.
Tina, yeah. Yeah, I really appreciate to collaborate this cases. I appreciate it, and hopefully we can collaborate, which Tina said.
Okay, so probably you'll discuss some other issues among the both of you. So Richard,
Yeah,
this is going to be the last question, since I think we were approaching 8 p.m. in Sumatra. But yeah, go ahead.
Okay. I just wanted to, in a sense, tie together a number of the previous questions relating to Jim's question about acceptance and Dave's question about what can mothers do, and to the, I suppose, to the question of what is it that families can do in Sumatra to, on the one hand, try and help their children not to get into problems with drugs, and what can they do in Sumatra as a family when their children have developed problems with drugs. Now, you've suggested that acceptance is a place that it's good for family members to get to, but you also said that acceptance means that really you've got to accept that this is God's will and there's nothing you can do. So I suppose I'm interested in both prevention and treatment. What is the family's role in prevention, and what is the family's role in treatment?
Thank you, Professor. A very interesting question. What is the role of family in prevention, and what is the family role in treatment? In a prevention focus, I mean, the family can collaborate with school or youth group, because teenagers usually working together with their group, and in their community, they're more likely to live together, share their experience, sharing their feelings in their community, and also the religious the leader of a religious group. It's very important, in my opinion, to booster the prevention program. And then for the treatment, for the public health center, I mean, as the at the part of a community, the health cadre in my country, there is a health cadre, there is lay people who educated to being closer with the community. There is the treatment, the role of family in terms of treatment, and also not only public health center, but also with the hospital, of course. The hospital, how between hospital and then also the public health center should be coordinate each other, because usually there is the gap services between public health center and also the hospital. So as the parents should know how to get how to obtain the service from the two health services, including counseling for the addiction, and it is more also the significant intervention. Also peer group among them. So the leader of this peer group can give the example to parents and also to teenagers. Is in my opinion, Professor Richard.
Thank you very much.
You're welcome.
Okay, so again, thank you very much for this valuable insight of the situation in Sumatra, Indonesia, and be great to see you, and hopefully we'll even see you again. There will be the upcoming AFINet conference in September 29th and 13th, and there will be the annual general meeting where I hope to see all of you as well. Even before that, we have another webinar on Tuesday, the 13th of September on gambling in Finland. And finally, we hope to meet all of you in person next year in Rotterdam, where we are planning to have a face-to-face conference again, which will be the second one after the wonderful conference we had in Newcastle. And so we're all hoping that COVID will be history by then. And it would be great to see you all also in a non-virtual setting. And I'm still optimistic about that. But for today, like I said, thank you all for participating. And there's been, again, like always in AFINet, many people from all over the world for your talk. And thank you very much for your excellent presentation, and see you soon at the next webinar.
Yes. Thank you.
Thank you very much. Thank you.
Thank you. Thank you indeed. Thank you, Ira. Really appreciate it.
Have a nice evening to Sumatra.
Yes.
Thank you. Thank you. Hopefully I can contribute again in AFINet. Thank you.
Okay, thank you.
Thank you. Bye-bye.